Okay, with fall season coming up, a lot of the times that's where a lot of ACLs occur. They've had a break over the summer, they've gotten a little deconditioned, and now your athlete's trying out for football, trying out for volleyball, has these long practices, sometimes 2-a-days, fatigue builds up, and within the first couple of weeks of gameplay, they're pushing themselves really hard at an intensity they're just not used to or accustomed to for the last couple of months, and an ACL tears. So let's say your ACL tears. What does that rehab look like? Now, I'm not gonna lie, it's a bear of a reality, especially for like a 13, 14, 15-year-old kid who can only see out 2 weeks into the future. You're talking about 9 to 12 months of a journey for them after they get cut into. But we break up ACL rehab into phases. So we kind of have focuses during each phase. Now there's a 0 phase, that's before surgery, and then phase 1 is right after surgery. So before surgery, what we really want to focus on is just calming the knee down. After you hurt something, it usually swells, and we want the swelling to calm down. We want to get our full range of motion back, and we want to figure out where your strength is and kind of start developing strength and getting comfortable with a lot of the exercises that you're going to be doing in rehab, so there's less of a learning curve. Another great opportunity for someone going into rehab before surgery is they can start to learn the discipline required of them during their actual rehab post-surgery. Rehab is not like an easy walk in the park. A lot of the times it's actually harder than just normal strength and conditioning. If you got a good therapist pushing you, you're going to be asked to push to your barrier of comfort every day. You're going to get really sore from it. Your muscles don't quite work the same after surgery, and so it can be frustrating to put a lot of mental energy into something and not actually get a lot of output back from it. And so creating a baseline for what the mentality needs to be like within a therapy session, and the discipline to go from set to set and kind of treat it more like a training session, because you're trying to train this leg to work again. That's pretty hard to do, and it's pretty hard to get a 13, 14, 15-year-old to understand that. And so the sooner we can get that conversation started, the better off they are long term. After you get cut into and you have a new ACL in your knee, phase 1 has a couple of goals. We need to get range of motion back. Your knee's going to be really stiff, and we need to get it back to fully bending and fully straightening out. You're also, once you get cut into, we have something called brain fart, neuromuscular arthrogenic inhibition. There we go, NAI. Basically, if you get cut into your body, muscles shut off. They don't want to deal with it. And then after surgery, you try to lift your leg and nothing works. And so you have to retrain your brain how to turn that muscle on. And so the representation of your brain not doing well is called quad lag. And what we want to see is that when you're sitting down on a table with your leg straight, you can lift your leg up and your shin just moves with your femur. What will happen with someone with quad lag is they'll lift their leg up and their leg will bend because their quad just doesn't turn on. Okay, we want to get quad lag away and gone. We want to get back to normal gait as you can, weight bear, and get back to walking normal. And then you have a scar that needs to be mobilized. That scar can get kind of tight if you don't massage it, move it around, and whatnot. So in phase 1, we're worried about all those things. Phase 1's kind of the boring part of rehab. It looks really clinically. You're like sitting on a plinth, doing a lot of like hands-on stuff, a lot of like just stretching. But then phase 2, once you've checked all those boxes around week 6, ideally, you start getting into the strength training part of rehab. Phase 2 is from about 6 weeks to about 3 months. So you got about a 6-week window there in phase 2 where the goals is strength, strength, and strength. We want to see by the end of phase 2 that you can push 1.2 times your body weight in a leg press. Okay, so we need to push the strength training. So a lot of the times in phase 2, athletes, if you didn't see their scar in their knee, would look like they're just lifting weights. They're squatting, they're hinging, their knee extending, hamstring curling, split squatting, etc. They're learning to use their body again in a lot of the same patterns you would do in a strength and conditioning setting, just under load and progressively pushing them harder and harder as they can handle it. Phase 3, at around that 3-month point, is when ideally, if you have an ACL and you're in surgery or you're in rehab, at phase 3 you should notice you're starting to do some kind of progressive plyometrics, so some kind of progressive jump training to prepare you for phase 4, where we start running again. You don't want to start running before you've started jumping, because jumping gives you a singular jump or 5 jumps to focus all your attention on. Running is essentially a lot of single leg jumps occurring back to back. So we want to first focus on just jumping in general before we start doing minutes of baby jumps in a row, like running. But if you can hit 80% strength in your injured leg in relation to your other leg in phase 4, that's where we start running. And we usually do some kind of progressive return to run protocol, where maybe you start out just running for a minute and walking for 2 minutes, and doing that 7 times or so, and then over 4, 5, 6 weeks, building up your running duration to something like 15 minutes at a time. Ideally, when you enter phase 5, at the 6-month mark, you have 90% strength in your injured leg, and you have 80% rate of force development, and you've checked off your return to run protocol. So return to run is done. You can run for like 15 minutes straight at a time. You have 90% strength, and then rate of force development refers to how quickly can you contract that muscle. So if I put your leg in a machine and then I have you contract as quick as you can, and we have you do it on both sides, the amount of force and the quickness with which you produce that force, there's machines that calculate this, so it's not something that like I'm just putting my hand there or we're getting you on a machine. We're using a device that actually measures the rate of your force development, and we want to see at phase 5, at the beginning of it, that you have 80% of that capacity in one leg over the other. And then phase 5, my funnest or favorite part of ACL rehab, is basically a return to athleticism. You're still strength training, but that's kind of on the back burner. You're doing a lot more athletic movements. You're doing a lot more athletic jumping type movements, like a lot of like skips, gallops, and bounds for distance and height. You're doing like depth drops and depth jumps and single leg hops, etc. But you're also doing a lot of like change of direction learning. So you're learning a penultimate step, how to like come to a complete stop and then turn back 180 degrees versus a crossover step versus a juke step. So you're learning how to cut again, because this is the thing, once you've been cut into, no pun intended with the 2 words, once you've been cut into, your brain forgets how to use this leg. So once we get you back 6 months in, just because you can walk around normal and jog, you don't remember how to decelerate. You don't remember how to do a 90-degree cut versus a 30-degree cut versus a 180-degree cut. And the mechanics behind those, you have to kind of be remembered and reminded how to do it. And then once you've been reminded how to do it, you have to push yourself hard while doing it so it mimics the same force as your sport. Because in basketball, you're not going to like do a juke step and do it slowly. You're going to do it really fast because you're trying to actually juke an opponent. And so in rehab, it needs to be performed at a high intensity. It needs to be performed under fatigue with like built up load modulation to the point that you're actually really fatigued when you're performing it. And so many athletes that have done ACL rehab with us find that at month 7, 8, and 9, it's basically like strength and conditioning. It's just protected and progressively graded strength and conditioning. But every day, it basically looks like a workout. Most of the times, those athletes are so fit at this point because they've been with us for 6 or 7 months that if you were to just have a random athlete sit in on their session with them and match them rep for rep, they would find that they actually probably perform better because you've had 6, 7, 8, 9 months of working with this athlete 3, 4, 5 days a week. And so the goal is to be able to clear all of your testing criteria by month 9. Sometimes that needs to be extended out for 12 months, and there's probably pretty good data to suggest you're better off waiting until 12 months, because just because your ligament is healed doesn't mean it's at its full tensile strength. Something I try to remind my athletes about is if they sprain an ankle and I'm like, oh, that's a grade 2, it's going to take 6 to 8 weeks to heal. That's 6 to 8 weeks for it to heal, for you to be able to return back to basketball or whatever sport you're in. But that doesn't necessarily mean it's not going to be sore or stiff or get achy, because it can take an ankle sprain 6 months to fully heal. It was just 6 to 8 weeks of the protective phase of healing that you didn't want to go back to basketball because you could screw up your ankle. But after 8 weeks, you still got another couple of months of full healing. And so expect for your ankle to be kind of sore, etc. With an ACL, the year after you're discharged is usually like a feel it out year. You're going to notice your knee doesn't work the same as the other one. It gets a little sore or a little quicker. If you have double days, it kind of builds up fatigue and gets stiff and tight in the morning and whatnot. So it's more of a journey that you're having to learn instead of just an end date where you're healed and now your knee will be the same as it was before.